There are a lot of problems associated with having a brachycephalic.
Even if they pant, they can't get rid of the heat fast enough, and they can get heat stroke and they can die from it, unfortunately. The eyes are almost a bit more out of their socket than they should be, which makes them more prone to getting their eyes popped out. You actually sit with a breed that it's been shown that they have a shorter life expectancy, even with all the surgeries.
But they're so cute.
I know, they're very cute.
Welcome back to the Pause and Effect podcast. I'm your host, Dr. Cara, and I'm in the studio with Dr. Inke. Welcome back.
Thank you.
This isn't our first rodeo.
No.
And last time we sat together, you were pregnant with twins.
Yes.
And you have had them, so congratulations.
Thank you.
How are they doing?
Thank you. They're doing good. They're keeping us on our toes, so yeah.
So I gave a bit of a break because I understand, obviously, being a new mother is very challenging. This is really our first opportunity as you come up for air to have a discussion. And I love this conversation. This is something that we've been talking about quite a lot, and that is brachycephalics, which we'll define. We're going to talk about the issues with them. We're going to talk about some of the solutions that we're putting in place, even within our practice, and the kind of advice that we give to owners. But can we start off by agreeing we love brachy's, don't we?
We do.
We love them.
We do.
So as a little disclaimer, vets are not necessarily allowed or should like them because there are a lot of problems associated with having a brachycephalic. But they're so cute.
I know, they're very cute.
So cute.
I know.
Okay, so let's start with a definition. What is a brachycephalic? What are we talking about when we refer to brachycephalics?
So brachycephalics is basically short-nosed dog breeds. And just to explain it better, it's if you take what we see as a normal dog, like say a Labrador, and you basically squash that nose and anatomy flat against the face, and then you get your brachycephalic dog. So that's basically what they are.
So literally, we're talking same anatomy, but just in a very smaller space.
Yes, exactly.
Right. Okay, so can we define what some of these breeds are, just for people going, have I got a brachycephalic? I don't know. My dog's face is a bit squished. I mean, can this be a mixed breed?
Yeah, so Brachycephalics is your English bulldogs, your French bulldogs, your Boston Terriers, your pugs, your Pekingese, and then you obviously have a few brachycephalic type of cats as well, like Persians. So that's more or less the most of it. But you do get obviously crossbreeds with brachycephalic in it, and that can lead to some problems associated with the fact that they have brachycephalic breed in them. They can also get some of the problems. And then also you get large dogs like bull mastiffs. They can also have the brachycephalic problems,
Sure. So this is quite a common thing that we're seeing.
Yeah.
I mean, these are great breeds. Some of them have, there's talk of Crufts and some of the dog shows banning these. So there's a lot of controversy around ownership of them and sort of promoting them because of the health issues that these breeds suffer.
Yeah.
So let's start with the anatomy, because I think maybe explaining some of the anatomical things will help then lead us into some of the symptoms and signs that owners may notice, and then some of the solutions. So you talk about that face being squashed, and is there any reduction in the number of teeth and the soft tissue? What is it that happens when the face is squashed?
Basically, there's no reduction in teeth or anything like that. It's literally just the face being squashed. So you have, imagine you have a Labrador with a normal soft palate, and it's basically being squashed. So then you have your, say, pug with an overlong soft palate because there's not enough space for it. The same they found with the tongue. The tongue, they are longer. They're longer and they're more thicker than your normal dog breed, just because everything is squashed into the face.
They're trying to fit a long tongue or a thickened for their frame into their mouths.
Yeah. So what basically the 5 most common things that they have, which is the primary problems of them, and then you have like secondary problems with them as well. But their nose, their nostrils are very narrow, and on the inside of their nose, the turbinates, some of them collapse, and they like lie on top of each other, which makes breathing quite difficult. Then they have an overlong soft palate, and then they have a really small trachea. And then they also have this big tongue for their face. And then, they get laryngeal problems, but that's secondary to those first anatomical problems they have,
So let's go through each of those, because sometimes what happens with owners is we use the technical terms and then they go, I don't know what that means. I was discussing this with Luke earlier and he was like, what does that mean? And when you're referring to those nostrils being small, we refer to it as stenotic nares. So if your vet advises that your pet has stenotic nares, what is generally the assessment of that? How do you, we're trained to look for that, but how could owners visualize whether their pets have got a problem with their nose and their nostrils?
So it's basically a normal nose, the actual nostrils will be wide and open, whereas these brachycephalic, it looks almost like it's collapsed. So they're pushed in and then their nostrils is just a little slit, basically. So that's what stenotic nares is.
Okay. Yeah. And that elongated soft palate, that's generally obviously very difficult for owners to see.
Yes.
Is that something that they would hear? What does that sound like?
So they would get something that they would get this really snoring sound, and also their dog would be exercise intolerant almost. So you'll find if you go for a walk, when they breathe, it's really hard and raspy, and it sounds like they're struggling to breathe. And that can be an indication that there's just not enough space in their throat to actually breathe properly.
Gosh. And then these breeds, and I know we're going to be talking about more the technicalities, but these breeds, as a sideline, as some of the secondary issues, like you say, you're seeing them in with skin fold issues and eye problems. What is happening there?
So they have actually shown that embryologically, let me just say, so when they develop in the uterus, they can, some of the skin and those things, they don't develop properly, and so they're prone to getting skin issues and teeth issues and eye issues. But it's also just because they're basically squashed, their face is squashed. So you have excess skin because it's just the normal amount of skin that's being squashed. So you have excess skin, they fold onto each other. We in Durban, it's hot, it's humid, so they get infections in between those little folds. Same with the eyes, because they squash, the eyes are almost a bit more out of their socket than they should be, which makes them more prone to getting their eyes popped out. So say they sustain any trauma to their head or anything like that, and the pressure increases, the eyes can pop out. So it's basically just that anatomical problem of the skull being flattened compared to your normal or your regular dog. I say normal, but your regular dogs,
And then the other thing we see them quite commonly for, that people may not associate with it being a breed problem, are dental issues. So is this also associated with the crowding in the mouth? How does this work in terms of accumulation of plaque and dental disease?
Yeah, so it has to do with the crowding of the teeth in the mouth. And then because it's so crowded and they're so on top of each other, there's a lot of plaque and bacteria and things getting stuck in between. And that obviously can cause bad dental health
Mm-hmm. And these breeds generally struggle with eating. And I mean, we've got some formulations or pet food companies that are tapping into this, saying we have solutions not only from a formulation perspective. I know UltraPet have developed a brachy diet that has a particular kibble shape and size, but also a formulation to try and mitigate some of the issues. They struggle to pick up food, don't they?
Yes.
And then same in terms of breathing, it's chewing and the difficulty actually getting enough air in. Are they more prone to issues like regurgitation and aspiration? Are those things that you're seeing?
Yes, yeah. So that is a big problem because they struggle to eat, and some of them are quite greedy eaters. They can have some of the secondary problems, is like you said, regurgitation, reflux. If they reflux and they inhale, they can inhale it into their lungs and then it can cause a pneumonia. And also they have what you call hiatal hernias, where it's sort of breed specific, and it's not necessarily just the upper respiratory problem that attributes to it, but it is a big factor in it as well because they breathe so hard. You have that extra pressure and that pulls the stomach sort of almost into the chest cavity. And if they have that, it's sometimes intermittent, so it's called a sliding hernia, so it can go in and out. And then, if they eat too fast, if they eat too large meals, and the stomach moves into the chest cavity, they can regurgitate their food up. And then if they do that too often, the regurgitation burns the esophagus, and then you can get an inflamed esophagus, which is also very painful. So
sure, these poor dogs. I think maybe the listeners are starting to understand why we're discouraged making comments like they're so cute. Because they do struggle. Hey there, pet parents. It's Dr. Kara, the Ultra Pet Vet here. Brachycephalic, meaning short-muzzled dogs, have uniquely shaped jaws that can make picking up and chewing normal kibble really difficult. That's why Ultra Pet has created a kibble specifically designed for easy pickup. It contains glucosamine, chondroitin, and green lip muscle extract to help support your dog's joints so that they stay mobile and active. The inclusion of beet pulp and prebiotics helps support a healthy gut by promoting the growth of beneficial bacteria in the digestive system. Omega-3 and 6 fatty acids promote a shiny coat and a healthy skin. Ultra Pet offers 100% money-back guarantee. Try Ultra Pet's premium recipe for short-muzzled dogs today. So let's talk about the trachea, just so that we stay on the anatomy and we unpack all of that before moving on. You spoke about hyperplastic and the tracheal collapse. What is happening there? What is the hyperplastic trachea, if that's mentioned in the consult?
So it just means that the trachea is smaller than a normal standard dog. You have a way of measuring it on an X-ray. Basically, you take a sort of the area of the thorax and you divide and see what. You make a ratio basically. But it says that if the ratio is 0.16 or less, that's a indication of a small trachea, hypoplastic trachea. But interesting enough, like your English bulldogs, it's normal for them to have a ratio of 0.14, and it's seen as normal. So yeah.
So what is happening then with the tracheal collapse? So if we understand now the hyperplastic means small, but what is happening with the collapse then? Is it a pressure thing? Is it when does it happen?
Yeah, so it is a pressure thing, and it all has to do because they have to breathe so. I want to say they have to breathe so deep and it's the pressure. So as they breathe, the trachea can collapse with that sort of negative pressure pulling on it. Yeah.
Okay. So when these dogs come into our practice, often it's we see them young. It's great. We see them young, and they're not always struggling. There are lots of things we can advise to try and best support them, but before they actually get to us, what are the kind of signs that owners may pick up on that could indicate that they need some veterinary guidance, whether it's to manage and reduce the progression of some of these things or to actually come in and try and get it sort of surgically or medically managed?
Yeah, so a lot of the owners, the first thing they tell me is he can't breathe with his mouth closed if he's sort of exercised a bit. So they struggle. If their nose is small, they can't breathe through their nose normally. And some of them come in and say they've never seen them breathe through their nose with their mouth closed. So that's one of your big things.
So open mouth breathing. Literally.
Open mouth breathing.
Okay.
Yeah. And then also some say exercise intolerance. So they run around a bit and then they're like completely collapsed and they just lethargic and they don't want to do anything and they struggle to breathe then. Also, when they exercise a lot, say for instance, they have a staircase and the owner would say something like, no, when it runs up the stairs, it makes this burping noise and it just some fluid comes out, which is regurgitation. And you see that a lot with them when they exercise. And then also, when they eat, they're messy eaters. And the kibbles fall out of their mouth. And so it's a difficult, there's a lot of problems that they come with you initially, and it is a good idea to bring them in and for us to have a look and see and say, okay, the nose looks a bit small and it needs to be opened up. But there are things that you can't assess with them sort of awake, and then your next step is a bit of sedation and looking at if their soft palate is long, doing an x-ray to see if their trachea is small, sometimes you can even see the hiatal hernia on an x-ray. So all of those things you have to do. So what I generally tell clients is if they do bring them in, say, for vaccination and they're small, and I say, okay, when we sterilize them, we can fix their nose. Okay, because their nose, it has actually been shown that if you fix their nose around about 4 months of age, then it can decrease some of the secondary changes that they get. So, because they sometimes get where their larynx, they have like these little sacs in their larynx, and they can prolapse sort of into the laryngeal opening. And so that'll be prevented. It also helps with, if they do have a hiatal hernia, to manage it. Because you don't have that pressure of breathing. And a lot of them that I've done, they've actually, like, my number one thing when I phone the owners post-op, I'm like, and you won't believe so-and-so is breathing with his mouth closed. And that's like a major thing for the owners. So, and then while they're under, you assess the soft palate, you see if the laryngeal saccules have prolapsed or not. And then you can advise them to get surgery for the soft palate at a later stage if you want to,
That's really, really good advice. And I know that you're doing these quite proactively. So rather than, like you say, you get to a point where there are multiple issues to deal with, actually being a little bit more proactive and sorting out one of the things can mitigate some of the risk of the other things. So one of the comments I often get is how people are so endearing until they sleep in your bedroom. That snoring, that turbulent airflow. And the hacking. Often they hack when these dogs, especially when, like you say, they're moving around, they're exercise intolerant. But the other thing I wanted to talk to you about, particularly like you said, we see it with skin folds, but we see it in KZN, is that perhaps it's with the exercise intolerant. These dogs overheat.
Yes.
They really struggle to regulate their temperature. Let's talk about that in terms of, obviously, you often see them panting. That's, trying to breathe, but also trying to dissipate heat.
Yes, So with all dogs, they obviously don't sweat. So the way they get rid of their heat is by panting. And what you have with these Brachycephalics is they have, first of all, an enlarged tongue. So the opening to the throat is already narrower. They have a long, soft palate, which also makes it narrower. Sometimes they have tonsils that are everted as well, which can also make it more narrow. And so even if they pant, they can't get rid of the heat fast enough. And that sort of builds up and they overheat and they can get heat stroke and they can die from it, unfortunately. So,
And we've had some terrible cases that have been rushed in. They've gone for a like a walk, or even if they haven't walked, the dogs have been chasing monkeys or, chasing other dogs up and down the fence, and they've come in collapsed.
Yeah.
And we know, obviously, the progression of heat stroke is the accumulation of more fluid and swelling, and that's just one of those horrible cycles of the course of heat stroke. So these dogs are particularly prone.
Yes, they're prone. And it's difficult to manage them when they come in, because first of all, you need to cool them down, and then you have to, I found with most of them, I have to put them under and intubate them and leave them on anesthetic for an hour or so for the medication that I've given them to work, for the swelling to decrease inside the throat. And then you slowly wake them up and take the tube out, and then you hope for the best, and you hope that they are breathing well now and they all cool down and fine. But heat stroke, it's another story for another day. But I mean, it can cause organ damage and those things as well. So
So before we go into the technical things, because I'd like the listeners to get an insight into some of the surgeries you're doing and what they involve. Let's talk about the secondary things, because we often find these breeds are prone to joint disease, bad skin. Not only the skin fold, but generally sort of itchy skins and atopic dermatitis. They are they're prone to heart issues. Some of these breeds on our list. Why is it that owners are still wanting to have them? Is it like an awareness problem? Is it that we just, like us, we find them really cute?
I don't know if it's an unawareness problem, because I've had owners that come and they know exactly what they gotten themselves into, but there are people that get them because they're cute and they don't know, what's going on, and they don't know that, you actually sit with a breed that it's been shown that they have a shorter life expectancy, even with all the surgeries, but that they will need surgeries to extend their life. And then in the end, it's still shorter than your normal dog. And it's, owners need to actually start researching and asking your vet for advice, and, to know what they're getting themselves into financially and emotionally in the end, because you have a dog that's not going to be there maybe for as long as you wanted to be there. But I do think their personality and the fact that they have this baby face is very attractive to people.
No, they have got great. I was hoping you would go there. They have got really nice characters, most of these breeds. So they definitely have been bred for their great sort of personalities, as well as like their very endearing looks. Those big eyes and like you said, the baby face.
Yes.
So you made mention of the proptosis, which means like where the eye pops out of its socket. So in the same vein, these dogs really struggle with eye conditions. Some of the surgeries that you're doing are skin fold resections and entropion dealing and managing the cherry eyes. Tell us a little bit more about that.
Yeah, so because they have because they have big eyeballs, well, it looks like they have big eyeballs because it's more
prominent,
pushed to the front, some of them struggle with closing their eyelids properly over. So you get a lot of the times dry eye. They're prone to getting ulcers in their eyes. And then if they have skin folds and the hair of the skin folds actually stick into their eyes, they also get ulcers from that. So that's generally when we do the skin fold resection to prevent that from happening, because in the end, if their eyes keep on getting ulcers, they're going to lose their eye. And then also, you can actually decrease the opening of the eye a bit to keep the eyeball more in, which can help with preventing, the eye popping out if something does happen. And then a lot of the times, especially if you look at your bull mastiffs and things, they have these eyelids that roll inwards, which causes like chronic irritation and ulcers again. and they get light sensitive, and it's very painful for them.
It's like having lots of hair in your eye.
Yes.
It literally is that.
Exactly, yeah. So, and then you have to do a surgery where you cut part of the skin away, and then you sort of lift the eyelid so that, no hair and things goes into the eye. So that's basically what we do. Yeah.
And then the turning in of the lids, I mean, I'm talking from experience because you did my Rottweiler. Yeah. You did Roach's eyes, and I mean, he's been so much better since. So he had the same. He was rolling in from the bottom, and you resected, and it made such a difference.
Yeah.
Because often, they've got sore eyes, and to actually manage these eyes, particularly in the event of them getting the ulcer, it's terrible because they're painful and they head shy.
Yeah.
So having a surgical solution is often
before
you get ulceration and you get long-term chronic damage.
Yeah. And the problem, and the thing is with those surgeries, it's a balance. So sometimes you need to do second or third surgery on those eyelids just because you don't want to take off too much. And first of all, change the dog's appearance, because we all know why the owner actually chose that dog. It's because of the mushy face. So you don't want to change the appearance too much, and you also don't want to do it, roll it outwards, and then you have other problems. So sometimes you have to just see, and as they grow, especially if they're puppies, it can change. Some of them grow into their skin, so you have to not be like happy and just take off skin and
so
suture.
You're quite conservative initially.
Yes, initially, and then you see what you end up with.
And I mean, with using the case example of Roach, the Rottie, I didn't need revision because we actually, it happened and the issue was a little bit later when he was fully grown.
Yes.
But we have seen it, like you say, in puppies, where you've got to be conservative in your approach, because otherwise, like you say, you end up with more of a dry eye or you other problems. So rather take off a bit and see. Also, some of these assessments are done, when they're conscious, and then when they're anesthetized, everything relaxes.
Yeah, it's difficult because then the eyes close and you can't really see properly. Yeah.
So true. So before we go into the subject of what happens through a resection of say a soft palate resection for that long palate, or what you do with the laryngeal saccules if they everted or prolapsed, as well as the nares, because I'd like owners to understand what you're actually doing there, because it's not just like making a little opening. I think it's very interesting. Let's talk about the recovery of these pets, because it doesn't really matter whether it's they're having a procedure done to try and manage some of the issues with the brachy's, or they're just having a spay or neuter, or they've got a laceration. We're very cautious when we have a brachycephalic breed that is undergoing an anesthetic, not only from a pre-op check where we're checking heart and lung and whatnot, but also on a recovery. Can you explain to the listeners what I mean by that and what I'm alluding to?
Yeah. So most of the complications that happens in brachycephalics is post-operative. So it's when they come out of surgery. It's when they recover from surgery. A lot of the times we would take, say, x-rays beforehand just to check if there's any fluid on the lungs, because that's also a normal thing for them. And that could potentially, be a problem when they start waking up. Also, when you intubate them, there sometimes is a bit of swelling in that laryngeal area, and when they wake up, the swelling can be too much, closing that small opening they already have even more, and then they struggle to breathe when they wake up. And we've had like one or two cases where it was an older dog, because with the brachycephalic airway syndrome, which is essentially what they have, when they're older and they haven't gotten any surgery when they're young, everything gets worse the older they get. So the soft palate gets longer, the larynx, they get sometimes laryngeal paralysis. So all of those things, it makes it very more risky for them to go under if they're older and they haven't had any corrective surgery done, because we've had 1 or 2, especially English bulldogs, that we ended up having to put a tracheostomy tube in for them to breathe after surgery. And it was something simple like sedating and shaving a hot spot and cleaning them. Yeah. So you have to keep a close eye when they wake up. You have to, they have a certain position you put them in when they wake up. You have to keep the tube in longer than you would another normal dog. Just before you pull it out, make sure they're awake enough
that they can swallow.
And they can swallow until you can pull it out. Some of them actually is awake and they sit with the tube in their throat and they're happy because they can breathe. So it is, yeah. So that's the post-operative part is the worst part of them undergoing surgery. So yeah.
So I know that this is probably maybe getting a little bit technical, but I just want to tap into just a small summary of what happens during each of these procedures so that owners who have had the advice to undergo it understand what's actually happening. So let's start with, and I want to just also take a moment to express to owners, when we see these patients, and I talk the royal we, and I'm not even consulting at the moment, but generally we start assessing animals when they're sitting in the waiting room. You're looking, I know you are looking at the confirmation, you're looking very, from the moment that you spot your patient, we're already making assessments. How are they moving? How are they breathing? What is the respiratory rate? What is the confirmation of that nose? But let's say you've assessed and you said, look, you say you start with the stenotic nares and try and widen that opening in order for them to breathe better through the nose. So take us through the procedure. What do you do?
So you basically take out a wedge of tissue out of both nostrils. So there's different techniques. There's some that you can do it on top, some you can do it at the bottom, but you take a thick piece of tissue, and it means not just the front part. You actually have to cut deep to get it out, and then you suture it close. And when you do that, it opens up, I want to say the concha of the nose, but it opens that cartilage of the nose. It pulls it more out, and so then they can breathe better. So that's sort of what you do with the nose.
And it's very successful.
Yes, yeah.
I mean, I think maybe some of them, I wanted you to explain, because some of the misconception that I've heard people say was like, well, what difference does it make taking a little bit out? But that incision actually extends quite far back, which is creating a better tunnel as such for airflow and less turbulence.
Yes.
Okay. So let's talk about the soft palate before we go to the larynx. Let's talk about the soft palate. And you say that particularly as they get older, that it's an elongated soft palate. It's flopping around. The only best way, we can kind of hear it. It becomes quite a visual thing. You can actually hear the turbulence. How do you manage that? How do surgeons go in and resect that?
Okay, yeah. So first, obviously, you have to diagnose it, and you'll see it a lot of times when you open up their mouth and you want to intubate them. The soft palate would be sort of over the epiglottis, and sometimes with these dogs, even if you put them under, they already go a little bit blue because the soft palate is now over the epiglottis and it's not pulling away. So, okay, and then you intubate them and then you look at the soft palate. So what you do is there are different surgeries you can do, and a lot of it overseas they cut with a laser. But generally here we just cut the soft palate, and you have a certain landmark you look at. So you look at where the tonsils are and you have a landmark as to where the soft palate's supposed to be. And then you basically cut off the excess of the soft palate and you suture it. But the idea with it is to not do any, to handle the tissue very softly and not do any excessive damage to the tissue, because after surgery there's inflammation. And if that swells too much and you still have that small opening, they can struggle to breathe afterwards. So and then sometimes you actually have to take the tonsils out as well to open up it more while you do the soft palate.
So there's a lot of assessment that happens and a lot of refining when you actually get the visibility that you need.
Yeah. And I mean, there is a technique that's for your I don't know, I've read papers where it's very successful and then it's not that successful. But when you have these Brachycephalics with a very thick, soft palate, and your English bulldogs are prone to having your thick, soft palates, there's a technique where you can actually thin the palate and then suture it up. So it's, it can be quite technically difficult, yeah.
Sure. And then let's talk about the trachea itself, because that is something. Well, no, before we go down, let's talk larynx. When we see laryngeal paralysis, I mean, this is something that we see in particular breeds that are not brachycephalic.
Yes.
So this is something people will be like, hang on a minute, my golden retriever had laryngeal paralysis. There are breeds that are prone to this. What are you seeing? What are you seeing? Like, describe to the listeners, like, visibly what you look for to assess whether an animal has laryngeal paralysis.
So in Brachycephalics, they actually say stage 1 of laryngeal paralysis is if those saccules are everted. So when you look down, you'll see these little 2 round globule things in the laryngeal opening, and that's the saccules that were everted. So that's sort of your first cue that this dog is going to be prone to getting laryngeal paralysis in the end. And then when they progress to a stage of laryngeal paralysis, you have to sedate them in a way that, and you have to choose your drugs well as well, but you have to sedate them in a way that you can actually see the larynx move open and close as they breathe. And so you'll see if the one isn't opening when it should.
You can actually look for symmetry.
Yes, you can look for symmetry, and you can see if they're opening, and if both are struggling to open, then you have a problem. Yeah,
and they need to actually be managed.
Yes, yeah. So generally when you do your soft palate and you see the laryngeal saccules, you take them out. You basically just snip them off, but they are quite far back. But the problem with that is some people would say, well, if you do the nose and you do the soft palate, won't the laryngeal saccules go back into place? And they've actually done studies and shown that no, even if, because technically they say because of the nose and because of the soft palate and the pressure when they breathe, the laryngeal saccules evert. So so they said that if you fix all of that, they should fall back, but they don't. So if they evert, they stay there, and you have to get rid of them surgically.
Okay. So let's talk about, because this will lead me into the next part of our discussion, let's talk about the collapsing trachea, that the tracheal collapse that, again, a bit like the laryngeal paralysis we see with, I like your term normal, but we see with other breeds of dogs. Yeah. There are some dogs like, although Chihuahuas are one of them, but we see that with Yorkshire Terriers, for example, we see a lot of laryngeal collapse. What is actually happening there, and how are you managing it surgically?
So it's very difficult. First of all, a hypoplastic trachea, you can't, it's small. That's just, you're going to have to deal with it medically. But if you have a collapsing trachea, then there's only one surgery you can do, and that's basically they insert a stent. They do it via a scope, and they insert a stent that keeps the trachea open. The problem with that surgery is it's not a lifelong thing, and the stent after 2 to 3 years start failing and then can migrate. So it's not... it's sort of a salvage procedure. Okay. Yeah.
That's a good way of describing it. So let's take the opportunity as we wrap up our discussion. I know we're running out of time, and we could talk about this for hours because it's fascinating for us as vets. But let's talk about some of the practical ways owners can help. And particularly, let's start with the collapsing trachea, because there's some advice on sort of the walking aids that we tell owners, like, don't use. Yeah. Can we go into some of the advice that you're giving from a weight management and walking and using leads or harnesses, the kind of advice that you're giving owners just to help manage the conditions, what they can do?
Okay. So first of all, weight is a big thing, and these dogs are very prone to being obese. or putting on a little bit extra weight, let me say it like that. And then, so weight management, so portions, don't overfeed your dog. And then also rather feed them small meals but frequently. So if you're able to, I understand some people are at work and they're not able to, but at least just feed them twice a day. But if you can feed them 3 times a day, that's a plus. Then when you take them for walks, don't take them out when it's hot outside. Try and keep them indoors and cooled off. And then when you choose a lead for them, don't choose anything that goes over their throat, or anything that like a choke chain, or anything that puts pressure on the trachea and the larynx. Don't choose anything like that. So just a harness should be good. That's basically sort of what you can do.
Absolutely, and those are great ways. And if owners are ever concerned, I mean, you're very good about sort of saying, take a video, like let's have an assessment of the extent of the sleeping. Because obviously when they're here, we get a lot and we gain a lot of information from taking history. But to actually hear them when they're sleeping at home and the noise, and look at their respiratory rate and sort of see what's happening, those are quite nice for you to be able to assess, particularly after.
The videos is nice. And also just make a point of, when they are struggling to breathe, look at their color. I mean, it's a good thing to tell your vet, listen, when we've exercised them and they're struggling to breathe, they go purple.
And you're talking about the gum color here.
The gum color or the tongue color,
Yeah. And even if, again, it's taking pictures, I know that everyone's got their cell phone at hand and are able to.
Yeah.
Very much so. So what, just final thoughts on it, what would you take home message say to people who haven't yet got a brachycephalic breed? What would you caution them? Would you ask them to come and have a discussion with you, to do their research? Like, what is the general advice?
So I would say do research, especially on the type of brachycephalic breed you also want, because there's differences between the breeds as well. And if you are wanting to know about anything, you can go and speak to your vet about it. And just make sure also I'm just going to say it, but take out insurance for your dog, because they might need a lot of surgeries. And then also make sure that you get a good breeder.
And maybe look at the parents, hey? Look and see how they're struggling.
Look at the parents and see if they're struggling, see if there's problems. A lot, like for instance, obviously your hiatal hernias and things like that, it can be a genetic issue. So, I mean, if the parents have problems with that, there's a chance that the puppies will. So, yeah.
And I think, to add my 2 cents, like it's good nutrition. Start them, don't overfeed them. Try and keep them slightly leaner. Good quality diet is so critical for these pets, from arthritic issues to skin issues to weight gain.
And some nutrition companies, they do make pellets specifically for brachycephalics to help them with chewing it and getting it into their mouths, and not being a big enough, too big pellet for them, and
And then be proactive with things like dental scaling and polishing. Those kind of procedures. I know owners are often very cautious about having their pets anesthetized, but having dental disease can perpetuate other problems. So mitigating some of the secondary issues associated with these breeds by either getting really good at brushing their teeth or using dental prescribed offerings, and then making sure that they maintain good oral health.
Yeah, and if you bring them in, say every year for dental, when they get intubated, get your vet to assess to see if the palate is longer, is the laryngeal saccules out now. Because there's some clients I tell them, you're going to have to do the surgery sometime. But other people I would say, listen, it's still looking okay, so let's just see how your dog progresses. But it's ideal to get those surgery done before the age of 2 in these animals.
No, that's really great advice. And thank you for all the work that you're doing to support these brachycephalic breeds. I know that a lot of our clients have just found it absolutely life-changing.
Yeah.
I mean, the feedback you get on some of your cases is remarkable.
Yeah.
I mean, these dogs are now enjoying a improved quality of life, which is ultimately why we're making this recommendation.
Yes,
so, it's great. So thank you very much, Dr. Inke.
Yeah. It's a pleasure. Thank you for
great chatting. Thank you for your time.
Thank you.
Thank you so much for tuning into today's episode on the Pause and Effect podcast. If you found the discussion helpful, please like, share, and follow our podcasts. Don't forget to leave us a comment or review. We love hearing from our listeners. Remember, you can listen to us on your preferred podcast platform. Welcome back to Just for Pets. You're with Dr. Cara.
Hi, Doc. It's Justin the Jack Rossi here, and boy, am I itchy.
Are you on a hypoallergenic diet?
Hyper what now?
Changing to a special diet will really help. And Just for Pets have a massive range. And flea and tick medication, special shampoo.
Ooh, how quick can I get some?
Order today and we'll deliver pronto.
I feel better already.
Justforpets.co.za. Vet approved, pet adored. Gets it all to your door.